this is a somatic. In the somatic one, if you can see persistent belief despite negative medical investigation and may develop thus different symptoms over the time, like first abdominal pain, then they will say they will have headache and stuff like that. But they don't make up like they have cancer or something like that. But even though they don't have any investigation, they will still say, oh, I still have had abdomen pain, like maybe after a week after getting medication. Okay. So it's like consistent, keep going. Now comes to the illness anxiety. In the illness anxiety, what happen is they always are anxiety. Okay, they think there is abdominal pain, they think they have cancer. Okay, like recently I saw a patient, she was having weight loss, not weight loss, yeah, she was having weight loss and hair fall. So in the both of the cases, she read it from Google and she thinks that she has some sort of thyroid going on or some thyroid cancer. She did not even think of hypothyroidism or a hyper. She said she has thyroid cancer. Now, because she said it was a weight loss, and I said I read that it was like the weight loss is consistent with the cancer. So now she's having illness anxiety disorder, and she's very much worried, and she thinks that she needs to be seen by a specialist right away. And the patient get easily alarmed with everything. Okay, and its duration is more than 6 months. So that's how you get to know this is illness with anxiety, like in some sort of illness with anxiety. Then comes the conversion disorder. This one, you did blood work, you did everything, you tell them whatever is going on, they still does not believe it. And they wanted to do MRI. I wanted to go for MRI. Okay. Or in this one, the very important thing they mention is like he's having, let's suppose, breast pain. So they will say that my aunt, she died with this, she had the same symptoms, and later on she died with the breast cancer. That's why they think that me, myself also has cancer. So that's how they come up with the idea. So that's how they make the thing. And now they start acting like, and even they will start having the symptoms of weight loss, fever, chills, because they start thinking that they have cancer. Hope that makes sense. I'm not complicating, but because this is important. So only the diagnosis part is important. So you can see in this one, does not need to be proceeding by a psychological event. However, there is a still worth exploring as many patients will present after such an event or related to a medical diagnosis in the first degree relative. So it could be related to some sort of thing going on. So in this one, they usually present with symptoms and it's more than 6 months keep going on. So in that cases, so you can see here the differences. The somatic symptoms like pain and everything in the somatic, it is present. In illness, it's mainly mild or absent. In conversion, it's neurological. They are thinking they are having it. Factitious, it's there. Malingering, it's there. Like, this, it's made up. Symptoms in somatic, it's unconscious. Illness is unconscious. Conversion, it's unconscious. I told you the words. In factitious, no benefit. Sorry. In malingering, there is benefit. In conversion, there is neurological symptoms. They're thinking they are having it. And when you assess them, there are symptoms. When it comes to illness, there is very mild pain. When it's somatic, there is very severe pain. So these are the words they will put in the scenario. Okay. Physical symptoms, you see, this is absent, this is absent, this is incompatible because they are having weight loss and they're thinking they're having weight loss. So they will have a weight loss. I hope that makes sense. So that's why when you do the check for the weight loss, there is weight loss. Although we're not very too much, but there is 2, 3, 4 kilograms of weight loss. Okay. So that's why the conversion is little tricky. And factitious, there isn't anything. And then malingering is also nothing. Dissociative personality, when someone is thinking that they are not attached to this world and something like do more than two distinct personalities. Dissociative amnesia, when they think that they don't have the memory. Okay. Then comes the depersonalization and derealization. Depersonalization is someone thinks that he is not attached to himself. Feeling of unreality, like, oh my God, where I am, oh my God, what is going on here? Oh, this is my car. Oh, is this why I'm feeling this? Like the way he's behaving, acting, he thinks that he's not himself. Okay. Then derealization is the feeling of unreality or detachment with respect of the surrounding. Why I am here? This is my house. Why this is my car? Why I'm in the car? So, even they sit in the car by themselves, but later on, this just suddenly, like, oh, why I'm here? So they can give you a little bit of these hints that can give you an idea that this is derealization. Very straightforward scenarios. Okay. Very straightforward. It will not complicate you. Then comes the sleep disorder. In this one, the slow sleep, REM sleep and non-REM sleep is the one. And then the OSA. Obstructive sleep apnea, we'll discuss that one. Management sleep hygiene is the simple and effective. Waking up, going to bed. So you have to always talk about sleep hygiene, making a sleep diary, avoiding screen to the bed, avoid napping, not using bed for the non-selective purpose like using TV and stuff, avoiding long-term periods of wakefulness, discontinuing or reducing consumption of alcohol, caffeine, and drugs, and exercising. CBT, taking a cold bath is one of the things. Soaking your feet in the Epsom salt is also helpful. So these are the things. Avoid benzodiazepines because they can become dependent on that one. It's like abuse. Okay. You can go for non-benzodiazepines. Which one? The zopiclone, zolpidem, low-dose diazepam. So in this one, Z drugs can be used as a bitter metallic taste. So they can ask you. The patient come back. They be like, "This I don't want to take this medicine. It's a bitter metallic taste. What is this medicine?" So which is improved by, or how can you counsel this patient? So in that case, you can ask the orange juice that can reduce the taste. Lambroxinant can be caused the wakefulness. It's not something that they can ask. Trazodone, dose amitriptyline can be used. Screen for the behaviors and then issues. Then you can see this one here. You can read all the disorders: insomnia, hypersomnolence, narcolepsy. In this one, you just have to know the diagnosis, and mainly the treatment is sleep hygiene. Mainly, just in those cases where you feel like the sleep rhythm is disturbed, then it go for melatonin. Mainly the sleep hygiene. So you can see in this one, insomnia. Insomnia is basically he's unable to sleep. Hypersomnolence, he's sleeping more than usual. Like at least, despite sleeping more than 7 hours, he's still sleepy. Then comes the narcolepsy, where there is a triad, irrepressible sleep. He just settle down, he sleeps right away. And then hallucinations, or these ones are there too. Then circadian rhythm, where the patient or people who change their job. So he was doing night shift, now doing daytime. So this can be there. Restless leg syndrome, like ants walking in their leg. And in those cases, always check the iron level. Very, 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 very important. The iron levels. Okay. Then go for whatever you want to give. Benzodiazepine, benztropine, or whatever is those ones, dopamine one that you give. Then the substance medication induced, then stop the medication, whatever he's taking, or change the time of the medication. Then the obstructive sleep apnea, it can cause a lot of heart conditions. So collapse of the lung, what happens is it's the problem with the driving. So always think of the involving the Ministry of Transport. And along with this patient has breathing issues, even though he's sleeping, he's snoring. Sometimes he has stopping of the breathing and then he has headaches. Then the central sleep apnea, where the breathing issues is more significant, and then hypoventilation, where there was problem with the breathing, stop breathing. Okay, in those ones we go for CPAP or BiPAP. Just the answer is CPAP, where the breathing is involved. Sleeping and breathing is involved. CPAP, simple answer. Non-rapid eye movement, in that one, incomplete awakening from the sleep, complex motor behavioral consciousness, and then like he's sleeping but his eye is moving. Just an idea. Sleepwalking is there, sleep terror is there. Sleepwalking is just walking. Terror is basically he is having the arousal from the sleep, like from some sort of bad dream. Most common does not, like most cases, does not involve any treatment in these cases. Then comes the nightmare. Nightmare is when patient remember what he saw in the dreams. Terror, they don't remember. In nightmare, you can remember with the nightmare. Nightmare, keeps like you can memorize or knows what is going on. In that one, just the reassurance. Then the rapid eye movement is basically arousal during sleep and vocalization, like violent injuries can cause it, and alertness or awakening. So when you call them, they are aware of it. Then in that case, you give melatonin. Okay. So then comes the sexuality and gender. We can start from here from tomorrow. I don't want it too much for you guys for today. So we'll start this one. But first thing, we'll go for marijuana. Please give me a reminder. that we should go for marijuana. I will try to find my notes for marijuana. So first do that one because that is very important. Then go for this one. As I said, you need to know how to make the diagnosis up till this much. You don't need, if you can't remember the treatment, it's okay. Because when we are going to do the medication, we will remember the treatment anyway from there. Okay. So just the diagnosis. Okay. Do a lot of MCQs. The MCQs are not like U word, how it's in the U word. You have to do a lot of MCQs to build your concepts. Once your concepts is good, believe me, the questions from psychiatry is very easy and very straightforward. You will not have any problem. Okay.